Joining me now to discuss the Victorian second wave is Federal Health Minister Greg Hunt. Thank you for your time, Minister, and welcome.
Hi, Sharri.
Is Victoria's outbreak a case of bad luck or is this bad management?
Well, we do know that there was a very significant breach with catastrophic outcomes in the hotel quarantine. Our job is to focus on the outcomes and repairing the challenge. We're not casting stones. We're supporting Victoria. We're supporting Victorians. We just know that this is immensely important. And in addition to that, obviously, contact tracing, we're working with the Victorians to make sure that they achieve that standard that's absolutely fundamental of every case, every day being followed up. And finally, of course, Victorians, Australians generally have done an amazing job at keeping their distance, but after the protests in Victoria, clearly there were some who saw a double standard and felt that if it was okay for 10,000, it's okay for 10, but it was never okay for 10,000. So they're the things that have happened in Victoria. But right now, our task is to support with the military, with assistance with contact tracing, with all of the things that are going to help flatten the curve again, because we do have to do it again in Melbourne, and to protect Australians.
Yeah. Look, I should point out, this isn't a case of just assigning blame. It is important to work out and understand what's gone wrong so that it doesn't happen in other states and that Australia isn't nationally
absolutely
back to square one. But look, you mentioned three things that have gone wrong in Victoria there. The issues with contact tracing, the protests, and also the issues with the guarding of hotel quarantine. Look, evidence has started to emerge, particularly in reports in the Australian newspaper, about the inadequacy of Victoria's contact tracing compared with other states. Obviously, you have a very unique insight into this. What exactly has been inadequate? What has gone wrong with Victoria's contact tracing?
Well, I'll frame it slightly differently. The challenge for each and every state is to ensure that every case is followed up every day. Obviously, the numbers are far higher in Victoria than we've been facing before. But we've brought in national support, assistance from other states and territories, assistance from the National Incident Centre, which is now helping to contact trace. And we know that they were not always able to meet that standard. I don't say that critically. A hugely challenging task. Everybody is doing their best, but we have to maintain those standards because that daily process of catching all cases every day means that we're then able to reach out to the contacts, to stop the spread, to make sure that they're being isolated and tested, and they're the things that are going to prevent the virus spreading. And so we have
in terms of contact
worked
tracing,
through the medical expert panel to do that.
How many people have slipped through the cracks? Are you discovering more and more instances every day where contact tracing just simply wasn't done at all in Victoria?
Well, there's no specific figure because, by definition, if you don't know who they are, you can't quantify it. But what the medical expert panel, led by the Acting Chief Medical Officer, Professor Paul Kelly, does is it works with each state and territory to make sure that they are meeting those targets. Now, we've seen some positive signs over the course of the weekend, the reports that I've had today. We've also been working with them. I was working with the Prime Minister right throughout yesterday on additional resources for Victoria. I've got to say he's been immensely focused on this, and through the course of the day we're engaging. Additional support was being offered to Victoria that he authorised, that he oversaw, that we worked on, and I'm very confident that they will pick that up. And that will assist with their quarantine, certainly their isolation checking, the work at police checkpoints, testing, hopefully with tracing. That's a matter for Victoria, but we've been deeply engaged right through the course
Minister,
of the weekend on working with them.
How worried are you now that this outbreak in Victoria won't be able to be contained and infections will spread to the rest of the country?
Well, there are always risks, and right throughout this, we have said that this virus is not over, that it is a case of permanent vigilance. We have a global pandemic. In Victoria now, the nation is coming together to support with practical action, personnel, remote tracing. New South Wales is doing a Herculean job in helping with remote tracing in Victoria. The National Incident Centre is assisting with that. Other states and territories, Queensland and WA, have provided resources.
And do you expect we will find more infections have spread to those other states?
Well, at this stage, we have obviously one cluster out of the Crossroads Hotel in Sydney. That is a serious cluster, but there is an extraordinary job of tracing going on. But the messaging to anybody who's been there between the 3rd and the 10th of July is to isolate and to test. More generally,
do you think that
New
cluster
South Wales
was linked
Health,
to Victoria?
I understand, is my understanding is that New South Wales Health is getting very close to identifying the original source. I am hopeful and confident that within 24 hours they will be in a position to identify that source, and I'll always wait for them to confirm and therefore to announce. But my advice is that they are very close to having a definitive source.
And that that's likely linked to the Victoria outbreak. While you're not confirming that, your understanding is that it's probably linked to Victoria.
No, look, I respectfully won't speculate until we have definitive outcomes, because that's their job to the disease detectives. Now, having said this, do I think we can do this as a country? Again, yes. 7 out of 8 states and territories are in an extraordinarily strong position. Victoria, by contrast, has a deeply serious outbreak. And we know that the number of people in intensive care is now at 17, 12 in ICU as part of those 17. We have the capacity to, within our system now, which is strong and well built. However, these cases are a risk, and so to everybody who has done the amazing job of reducing movement, isolating, I know it's difficult, but thank you, but we have to keep going. But do I think we can get there, which is your essential question? Yes, I do. Will there be some difficult days, some bad days? Yes, there will be, and I think it's very important we're honest, but we are beginning to make progress on assisting Victoria with the tracing, assisting with the making sure that the isolation is strong, and Victorians themselves, Melburnians in particular, are doing a great job with movement, having plummeted in recent days.
Yeah. Minister, given Victorian Premier Daniel Andrews chose to hire cheap security guards, given he knocked back help from the ADF when you offered it, given his contact tracing effort has not been up to scratch, was it right for him to partly blame Victorians for this second outbreak, which he did at a press conference during the week?
Well, my approach has been to say that I think Victorians deserve all praise for an extraordinary job. I do not think that Victorians, as a general rule, have been anything other than vigilant and extraordinary. We do know, following the protests, that there were some who looked at those protests and said, well, if it's okay for them in mass, surely it's okay for us as a family. But it never was, which was why the Prime Minister, Professor Brendan Murphy and myself were all absolutely clear. These protests were not safe. The example that they were setting, perhaps moreover, was not safe. And that has been our approach. I won't reflect on the Premier. I will say that our view is that Victorians and Australians and the medical personnel have been the heroes, but we now have a significant outbreak. We have to do the work again, but the signs we are seeing in terms of the movement data, in terms of the fact that people are increasingly embracing masks where they can't social distance, that people are respecting the distance. I've seen it in my own community. The behaviours are changing positively again. Okay. Having said that, that gives us a pathway.
Look, just before we're out of time, just a couple of other things. Are you worried that this Victorian outbreak will threaten the Trans-Tasman safe zone that you've been negotiating with New Zealand over?
We're working very constructively with New Zealand. I can understand that for the time being there wouldn't be any travel from Victoria. So do I think we'll get there with New Zealand? Yes.
But it's not going to threaten it taking place with New South Wales or Queensland or other states?
Look, I'll leave that for New Zealand, but on balance, my advice, and I haven't been one of the negotiators, is that we are making constructive progress with New Zealand.
Yeah. Look, the PM is getting criticism once again for taking a holiday. This has just emerged during the day today. Also going to the football last night. You cancelled your personal leave, which you were due to take next week. Is the criticism fair of the PM? Does it set the wrong example when he goes to the football, or does he deserve a few days off?
Two things. Firstly, in terms of around the country, where it's appropriate for people to go about new activities and new behaviours, we're encouraging that. And he was demonstrating exactly what we're encouraging in an appropriate way. As for the PM, he worked right through yesterday. I know, because I was working with him, working on a new level of support for Victoria over and above everything that we've done, an additional offer of the ADF. I've been working with him throughout today. And so this fellow never stops, and he is
so basically, Minister Daniel Andrews,
the fundamental reason that we are where we are.
Yeah, so basically Daniel Andrews has ruined the first day of the Prime Minister's holiday. Greg Hunt will...
Oh, well, I won't... I'll just say this. I have never seen anybody work harder in my life and more effectively in protecting a country.
Yeah, and you've all been working hard. I know you've had at times 800 calls a day or something. I think all the leaders have been doing their best.
It's been a little bit busy, but we're fighting for something that matters. And at the end of the day, do I think we'll get there? Yes, I do.
Yeah.